Welcome to 9 to 5 Wellness Podcast. Today, we are talking about strength at every age. And I'm super excited about this conversation because I feel like we have normalized living with pain, especially as we age. But it isn't necessary. Many people accept pain, medications, and then a lack of movement as a normal part of aging. But it doesn't have to be that way. And that's what we are going to explore today. It doesn't matter if you're in your roaring 20s or maybe you're in your 30s and busy with your family, or maybe you're navigating midlife, or maybe you're embracing golden years. Your body is capable of extraordinary things at any age. So today in this interview, we are going to break down what strength truly means at every stage of life. We are going to move past the aesthetics, which is part of it. I think that comes once you have better movement. That comes after you're pain-free. And then we are going to dive into the biological, mental, and functional shifts that happen across the decades. And I have a very special guest, very knowledgeable guest joining us today. Our guest today is Dr. Michael Guadagnino. He is a chiropractic physician, wellness advocate, and author of the best-selling book, Fitness Over 50, 60, 70, and Beyond. He's dedicated to helping people achieve better health through natural care and lifestyle choices. Through his chiropractic practice, he focuses on improving mobility, reducing pain, and promoting long-term wellness without unnecessary drugs or surgery. He is also the author of a wellness-focused book that shares practical insights on health, prevention, and living a healthier life naturally, especially for those Gen Xers and baby boomers. Welcome to the podcast, Dr. Michael.
Thank you. Well, thank you for having me, and nice to meet you, Aisha.
So nice meeting you. So I'm super excited about this topic, and I can tell you that a lot of my audience members, they're always looking for how to have more strength at different ages, especially after midlife. You know, a lot of my audience members, I get DMs on Instagram and LinkedIn that, oh, I don't know where to start. I feel like I'm behind and I don't know what to do. So I think this conversation is something that they're looking for. But before we dive into the topic, I want to know about you. I always am curious about my guests. Can you tell us a little bit about yourself and your background? How did you get into this?
Sure. People always like to talk about themselves. But I've been a chiropractic physician. I've been practicing for 33, 34 years now. I received my bachelor's degree first. I did my pre-med. I received a bachelor's degree. And from there, I went on to chiropractic college, where I've been practicing. I've always been into fitness, into health. As an athlete, as I was younger, I started doing karate when I was 6 years old. And I was pretty regimented with it up through college. Then we started doing pre-med. Doing a lot of extracurricular things became a little more difficult. But I always continued to work out, always continued to exercise. It's still to this day. I have one of my favorite parts of my house is my workout room I have in the basement. It's a nice place where I go down there. I can work out. I can get with my thoughts, and which is also part of fitness too. And so I'm married, 2 kids, one married, one will be getting married in another year or so. So pretty active, and I just turned 60 years old, so I'm over that 50 and over.
Oh, wow. Congratulations on everything that you just mentioned, that your kids are older, independent, one is married, the other one's going to get married soon, and then the fact that you're 60, wow, you make like 60 a place to be. So that's great. And I want to highlight something you just said about fitness and working out, like your workout room and exercise room and home is your favorite part. And you go there to get mental clarity, right?
Yes.
And I
sure.
think we don't realize that it's not just the physical aspect of exercise and or working out and or fitness that is important. Mental health and mental clarity is also a derivative of fitness and or workouts and physical fitness. So let's talk about fitness. What do you think are the biggest misconceptions people have about, especially when it comes to aging and fitness?
The biggest misconception is I can't do it. I've never done it. I can't do it. And really, people become overwhelmed. If they look at someone who may be 60, 70, 80, who's in really good shape, and they may not be, to them, a lot of times I see where they kind of turn themselves off to it. That can't happen. And it can happen. One of the things I talk about in my book is don't compare yourself to other people. Compare yourself to yourself. How can I be better tomorrow than I am today? How can I be better the day after, and continue that way? And just work on those small, gradual changes. Just gradually change. If you're someone who hasn't exercised in a while, someone who doesn't have a great diet, start reversing that. Go for a little bit of a walk. Go outside and touch grass and breathe air, fresh air. Change your diet just a little bit. Even if that requires cutting down on eating desserts, and you work your way that way. And just slowly climb those steps. So the biggest misconception is that I can't. And the truth is, you can. And again, don't compare yourselves to Arnold Schwarzenegger. Compare yourself to yourself.
I want to underscore what he just said, that break that big goal, whatever that looks like. Maybe that looks like having a six-pack for a lot of people, no matter what age, honestly, or whatever that is. But think about it, how you can break that goal into smaller steps, and then what those first few steps look like. Maybe that's like a 10-week program, but what does that day one look like? And maybe the day one, as you said, it's just 5 minutes going out, walking on the grass, or just doing some breathing exercises.
Mm-hmm.
Yeah.
Yeah, and I tell people too is to get yourself a notebook. And I know younger people, you do everything on their cell phone, but us older folks, we like to write it down. Get yourself a notebook. Write down your goals. What would you like? Would you like to lose weight? Would you like to be stronger? Would you like whatever that fitness or that mental wellness goal is? Write it down and then reverse engineer it. How can I get there? And you just keep breaking it down and breaking it down. You break it down to the smallest steps. Again, today I'm just going to do this, and then tomorrow I'm going to do that. And the truth of the matter is, as you get yourself moving and doing more, you're going to want to do even more. And also having it written down in front of you keeps you accountable to yourself. So make yourself feel guilty. And I didn't do this today, so I'll make up for it. But so it's really good to, again, challenge yourself. And some of the best things, that's why the best thing is when I say it's my workout room is in my basement. My whole basement is a workout room. And it's what you do in your basement that determines how you're going to be when you get out of it. So it's what you do in quiet, what you do in private is where it will determine where you will be as you continue to grow, continue to age. And you can go, and I also use the example, which I've heard many times, if you're on a pathway, just make that small change to here. And as a week goes on, 2 weeks, a month, years, you're in a different spot. So just break it down. Start slowly. Get that notebook. Just start slowly. Don't be overwhelmed, and just take that small step. And you'll be happy you'll be happy with yourself as time goes on.
I want to underscore what you just said about get a notebook and take notes, or whatever your goal is. Maybe just write that goal down, and then I'm a big fan of reverse engineering the solutions and or breaking it down into smaller steps. And I want to tell you why, because I recently actually read a research study, and I also heard it on another podcast. I can't place it where it was, but if you write things down, you actually are creating neural pathways in your brain that are gonna start actually taking action towards that goal. There's something about looking at that written word and the act of writing. That means you're actually engaging all of your 6 senses, and then your brain is registering it, and you're going to start actually taking those steps. So I'm a big proponent of writing down.
Yeah, and you're also taking it from being just an idea to taking the first step. The first step is coming up with a plan. Am I writing it down? And you are beginning that. I completely agree with everything you just said there. It's beginning your actionable steps. And the book might be the actionable program, but writing it is the first step to get you moving. And that's why I'm a big proponent of that. But I still have books and notebooks where I write down things, ideas, thoughts, and expand upon it.
Absolutely. Absolutely. Big fan of that. Okay. So if the biggest barrier for people is getting started or not knowing, feeling overwhelmed, how can then people in their 50s or 60s, let's say, they haven't been working out? And I see a lot of people, and I work with a lot of clients who would tell me that they were collegiate athletes, and then after that, life happened, and then they, just they couldn't be active, and they're coming to me in their 50s, and they're like, I don't know what to do. Like, I know what to do because I've done it in college and high school, but I don't know if I can get started again. So how can they get over that mental barrier?
Yeah, collegiate athletes, that's a good point, because they're competing at such a high level and they're in such a level of fitness that they're always comparing themselves to that person. And they have to realize that person at 21, 22, is different now. So you don't need to compare yourself, like even being at 50, I don't need to compare myself what I was like when I was 26. I mean, that's just wrong. So it's getting yourself started again. It's just basically, you want to make that switch from whatever it is that you're doing to that level of where you want to go on that fitness journey. And sometimes it's just a little level of meditation, sitting in a quiet room, watching some motivational videos or books that can get you to turn that switch on. And just really, it's just a small switch. It's a small switch. Again, comparisons are bad, but just where do I want to be in a year, 2 years, 5 years? And what will it take me what should I start doing daily to get myself there?
Absolutely. I want to talk a little bit about aging process, especially for women. It could be earlier, like in their 40s, late 40s, and then for men, especially after their 50s, which is some things start changing in our body, right? There are hormonal shifts, especially, which are driving low muscle mass. Sarcopenia, we call it. I want to talk a little bit more about it, explain what sarcopenia is to our audience members, and then why does our body start losing muscle mass naturally?
Yeah, sarcopenia is in Latin is basically loss. Sarco is muscle, penia is loss of muscle, like osteoporosis, osteopenia. Osteopenia is the loss of bone. Our body it just begins to change. The hormonal levels change. And what they've shown is with exercising, fitness, especially with weightlifting, or should I just say weightlifting, but saying resistance training, whether that be push-ups or pull-ups, some sort of resistance training. There's another scientific term called Wolff's Law. And Wolff's Law states that bone put under stress will continue to grow and develop and stay strong. Bone that doesn't begins to become osteopenic at various levels. And by doing resistance training, you're beginning to, or continuing to keep that muscle strong. Your body is saying, we need to make these bones stronger because this person's lifting 20 pounds, 50 pounds, 100 pounds, whatever it is. So that helps. And also when you're doing the resistance training, you're continuing to put your muscles under a level of stress. Now, metabolically, things begin to change in our body. The hormonal changes. There's another thing that I'm a really big proponent of people especially over 40, is taking the supplement CoQ10. CoQ10 is found in the mitochondria in each and every one of our cells, which produces the energy that gives us the ability to metabolize, just to be aware, to be awake, all of it, and everything that goes on in our body. And we may need to supplement that CoQ10.
Absolutely, yeah.
Yeah, it's really, they've shown some research showing how CoQ10 has really helped people who take statins. I don't want to talk about statin drugs, but people who take statins, they're recommended to take it because it really drives the CoQ10 out of your body. it's also shown with people on a chemotherapy. I'm talking about the most extreme situations. It's really important because it keeps the heart strong. It's just also very important, people with heart injuries to take the CoQ10, because again, that helps the heart. So there's a lot of research on this. And that's one of the supplements I really am a big proponent of. People, when they get over that age of 40 or so, and especially as you work your way up to 70, 80, 90, to continue to take that CoQ10. And it takes about 3 months of starting to take it before really your body has developed a good level of it, where it's now part of your normal function, normal metabolism. So it's just, and the big difference is aging is one thing, degeneration is another. We don't have to degenerate. I mean, we're only here for a short period of time. We might as well be at our max that entire time, not surrender and give in to that degeneration process.
Yes. I just want to highlight what you finished with, that, yes, aging is one aspect, which we kind of can't prevent it. We don't have any control over it, but degeneration, right? That, do you want to stay functional, or do you want to start going towards dependency, as I like to call it? And nobody, I've worked with thousands of clients and patients, and nobody comes and says I want to be dependent, in my later years. But then at the same time, they're kind of a little lost, because they're but I don't feel the same. I don't feel that energy. I feel weaker. I feel things are changing in my body, just energy wise. So I really appreciate that you mentioned CoQ10 and mitochondria. Mitochondria are, I know the process is very complex inside, and as a physiologist, I can go all over it, and I've talked about it on my podcast. But just to understand it in simple terms, they are powerhouses. They are responsible for converting your fuel to ADP. ADP is your energy molecule. So the reason that you start feeling fatigued sooner or tired, and you're I don't feel the same as I did 10 years ago, it's because the mitochondria inside your body are changing. But that being said, let's talk a little bit about muscle mass, because that's something that my audience is very interested in. So we start losing muscle as we start aging. Now, how can someone, let's say, who is in their late 40s or just hitting their early 50s, start preventing that? Because that's kind of around the time when we start seeing that shift happening. How can we stop that loss in its tracks?
Well, yeah, you need to eat right too. I mean, you really need to stay away from these processed sugars and processed foods, and eat more natural, more healthy, more proteins, amino acids. I mean, that's important too. You can't exercise your way out of a bad diet. So the exercising is going to push your body, push your muscles to be stronger, continue to grow, continue to lengthen. But the fuel you put into your body too is very, very important. And another thing too, they've shown is rest. If you can get your 8 hours, that's when your body heals. That's important too, to keeping your muscle mass.
You stress your muscles, but then the recovery is where they actually grow stronger.
Yeah, in the most basic terms, in the most microscopic terms, lifting weights is ripping and repairing. Mild microscopic tears, and you repair. That's how the muscle gets bigger. Which I'm sure you know, but so you need to put that fuel, that correct amount of what your body wants, to help build that muscle back up in the proper way. If you flood it with processed sugars and stuff like that, it's not going to happen for you.
Okay, I have a couple of follow-up questions for you right here. Because first of all, let's dive into the exercise component, because I want to know what your recommendations are. How often should someone, let's say someone has a foundation or has been working out for 3 to 4 months, has done some basic stuff, right? And now wants to get more focused, wants to have a more structured exercise program where they're preventing muscle loss and or building muscle mass. What would you say they should do?
I recommend, and again, most simplistic terms, each muscle part twice a week. Now that could be 4 times a week of total exercise, but just do each muscle part twice a week. And as you get older, you really need to listen to your body, because sometimes you can go, I might go hard for 3 months and not miss a workout, but I just feel my body needs a rest. So you kind of plan it. You just give yourself a weekend off or something, or a couple of days off or something like that. But that's what I would focus is basically each muscle part twice a week. I don't know if that answers your question.
Yeah, it does. I just want to add a little bit to it. So 3 to 4 days of strength training is mostly what's recommended, and I recommend the same. And then, as you said, each muscle group should be hit twice, depending on what volume you have, like how many reps and sets you're doing of a particular muscle group. So let's say you're doing chest and shoulders one day, because they're both push muscles. Chest and shoulders, you're going to do like push-ups. These are example exercises, bench press, and then shoulder press, right? So if you are hitting, in my experience and with all the research I've studied and what I learned in school too, that if you're doing 5 to 6 sets or more of each exercise, then you can hit it once a week. If you're doing only 3 sets of 10 to 12 reps, which is also another very common recommendation, then you need to hit the chest and shoulders twice a week.
Yeah, it also depends on how you want to break it down. I mean, if you want to be in the gym a longer time, would you rather be 2 shorter times? That's so I kind of proponent of the shorter times, get in, get out. And but yeah, what you just said there, I completely agree. It makes a lot of sense.
Yeah.
Another thing too, I like to do on an off day, at least one off day a week, some sort of stretching. Whether it be restorative yoga, whether it be just going through some stretching exercise, especially because as we all get age, joints like our hips, our shoulders have a tendency to tighten up, and just doing some basic, nice stretches on those particular joints helps keep them flexible too.
Absolutely. I'm a big fan of yoga. I'm a yoga instructor too, and I teach yoga. And I feel it that, as you start getting older, you start losing flexibility. And the more you're hitting the gym, you're going to start losing flexibility. And it's good for balance. Not only flexibility, because we start losing balance. And then, if you're not careful with balance training, guess what? You're putting yourself at risk of falling.
Well, especially as you get older. Yeah, it's a big thing I tell with my older patients. And I tell them to do basic things, eyes open and then eyes closed, to work a different area of your brain, which is important to you. So it's all there, yeah.
Yeah. So, okay, you touched upon nutrition a little bit earlier. Let's talk a little bit about not eating a lot of simple sugars, because that is something, our body doesn't need a lot to that, unless you're an endurance athlete, which most of us are. Yeah. Only they can get away with it. Or like if you're doing HIIT training 3 or 4 days a week, like, if you're going really, really hard, again, that has to be someone who is a professional athlete or has a training plan that they're working on. Other than that, most of us, we don't need as many simple carbohydrates. What else? What else are we looking for muscle mass and bone health?
The answer, when it comes down to sugars, natural sugars come with a default, because they come in a lot of fiber. If you eat an orange, you're not getting as much of the sugar as you would if you ate a candy bar, or if you drank juice, because those fibers fill you up. The fiber in watermelon, fiber in all the fruits and all the vegetables. So they come. Nature's an amazing thing. It comes with its own safeguards. And I talk in my book about, I actually break it down. I explain different types of diets. I don't know if that's the right word, but different types of nutritional ways of eating. I talk about the keto way. I talk about the vegan way. And it's really and I talk about Mediterranean and a few others, that it comes down to what's best for you. Everybody's metabolism is different. Everybody's stomach is different. Everybody can handle different things. Some people have different morality where they don't want to eat meat. They don't want to eat. So I talk about, if you're going to eat vegan, you have to eat whole food vegan. You have to make sure you get all your proteins, all your amino acids. And so I break it down. So I don't really tell people how to eat, but whatever way you do, make sure you're doing it right. Make sure you're not skipping on different things. And if you're eating vegan, I suggest you take some B12, because you're not getting any B12 from vegetables and fruits.
Yeah, and then they also have to up their protein volume. because the vegetarian protein doesn't get absorbed as well in the body. So they have to eat like double. I go a little high protein, so then I recommend double the amount than what a non-vegan or vegetarian would eat. Vegetarians have it a little bit easier because they can still consume milk and dairy products have a lot of protein,
Right.
and eggs too. Okay, so that's where we are at. Let's talk about balance. I want to expand on it a little bit. How does consistent resistance training reverse the effect and lowers the risk of fall?
Well, you're working what's called the proprioceptive muscles, in which are the smaller muscles. And the proprioception is knowing your space, where your body part is in space, in the most basic of terms. And that allows you to help prevent falls, prevent losing your balance, because your body, and you've developed those levels. That's why I strongly recommend free weights, because free weights will really work those proprioceptive muscles. So it doesn't have to be big, heavy. You don't have to be throwing big weights up. Even if it's like 2.5 pounds, whatever you can do. But it will work more than just the bulky muscles. It'll also work those smaller proprioceptive muscles. As well as it helps with the balance in the fact that you know where your hips will know where your body is, your knees. And it just works that whole level of system. And again, like I said, sometimes I even have patients who are in a walker, and I tell them just to kind of do some squats and then do them with your eyes closed. So you're working different systems within your brain. With and because falls are big. It's a big thing with people when they age, and broken hips are not a nice thing, not a friendly thing.
Yeah, the mortality rate is really high with a hip fracture. So, okay. What role does movement and exercise play in chronic pain? I know that you're the pro as far as pain medicine is concerned. So help us understand why exercise can help us with pain.
Yeah, as my one chapter is called "Movement is Life," and you need to keep those joints lubricated, those muscles opening and closing. A sedentary lifestyle, it just leads to things becoming tightened, becoming stiffened, and makes you susceptible. Now, even you think about even your organs. The more exercise you do, you're expanding your lungs. You're making your heart pump. You're making the blood flow to your arteries and coming back to your veins. It just has a huge. You make your liver has to break down the lactic acid. All your systems are benefited from exercise, which will help prevent many chronic pains. And I'm not. It was as we talk here. I'm not or disqualifying the fact that some people do have injuries. Some people do have issues that have developed that are serious issues. But there are things you can do around it. There's chair yoga. There's water aerobics. There's, as you mentioned, there's yoga. There's softer types of yoga you can do. You can do something and to help prevent. And if you have a chronic disease or illness, what you can do to help lessen that fact and prevent it from becoming worse. So movement is movement is life. It's just so important in the overall health, being, and preventing the chronic disease.
Absolutely. And I agree with you that there's a big population who has either illnesses, that they can't control, and they come with some limitations, or people who have been injured in the past and have some limitations regarding that. So if somebody has had a prior injury that wasn't rehabbed properly, and or post-surgery they developed scar tissue and now their range of motion is limited, I always say, like, hey, let's fix this muscle imbalance, and then we can work from there, and we can have that rehab exercise plan integrated with your strength training plan so that you are moving better and you're not actually now loading your muscles and or joints in a way that now it's going to exaggerate the situation that or the pain that you have. So that is one way to go. But as far as patients who come with chronic illnesses and or illnesses where, there are certain limitations, I completely agree with you. Like, there's so many options that we can explore, right?
And things such as chronic illnesses, such as type 2 diabetes, I mean, you can help prevent
And
it.
that actually it helps it.
Yeah, you can help prevent things like that. And there are also some research that shows that exercise can help prevent cancers. So so that's chronic disease too. So just keeping your body moving, putting what's in it, which was right and healthy. It just, again, it's that you're only here for a short period of time. Let's make the most of it.
Yes. Yes. Certain types of cancers, especially the cancers of GI tract, there's a lot of research out there that you can avoid those or prevent those by doing regular exercise. Okay. Do you, I always ask this of the healthcare professionals, like, do you have like a memorable success story from one of your patients or a few of your patients that you'd like to share today?
I'll talk about just one particular one. 82 years old. She fell and she broke her neck. And it really, you would think that's the end. I mean,
Yeah.
but we kept her positive. We kept her doing her rehab, made sure she ate things that would help her. And she came out of it. And she's back to 83 now, back to her regular lifestyle. She has some limitations in range of motion. She's still doing rehab on that. But it can be, no matter what. And that's probably the most extreme. That's very recent too. That's why I wanted to share that one. But
Yeah.
it can be done. It goes back to what we first said about where do I start? How do I not give up? How do I not accept what is put in front of me? And what I can do to make myself better. Better today than I was yesterday, better tomorrow than I am today.
Yeah. So those are great words. Yes. It starts your mindset. Can you shift your mindset first? Because if you can, you're going to be successful in whichever like route you take to get to your end goal, whether it's to live with less pain or eliminate pain and or live an independent, more functional life, right? And or increase your muscle mass and or get your six pack so that, you really look great.
Whatever your goal is.
Whatever your goal is, right? And a lot of times the aesthetics, they actually come as a result of you putting in the work for something else, like, living with less pain or whatnot. So, Dr. G, do you have any parting words? What advice would you give someone over 50 who feels like it's too late to get fit or, change their habits?
Yeah, this is what I'll say, and this is what I've told my kids since they were younger, and I still tell them today. Never settle. Never settle for anything, whether it be anything in your life. I used to tell them for a career, for a spouse, for anything, never settle. Again, we only come through this life one time, and we're in and out. And that comes with your health. Don't settle for being chronically ill, not in the shape you want to be. You might want to throw a ball with your grandkids. I mean, don't settle for, I can't do. Work on it. Start little, start small. And that's always my parting words.
Oh, I love that. Never settle. This could be like actually engraved somewhere. I'm going to write this in my notebook today, actually. I love that. Because as you just said, it can apply to every area of your life, right? Not just health and fitness and, but all the other areas too, your profession, your career, your business. Yeah. And your relationships.
Never settle. Yeah.
Yeah. Yeah. Yeah. Those are great words. So where can our audience members find you so that they can connect with you and learn more about your work?
All right. The best spot to find me is my website, which is drmguad.com, which is drmguad.com. That's my home base. You can reach all my social media, my YouTube page, my blog. I blog once a week on different health issues. My social media, which I'm mostly on, is my Instagram, which is Dr._Guadagnino. You can see my name spelled on the title there. And from there, you can reach out to me in every way possible.
Awesome. And I'm going to include your website link and then Instagram and LinkedIn in show notes as well so that they can see it.
And you can also get my book from that website too. I have a limited number of signed books too. So
I love that. Yes.
Yeah.
Please go ahead and check out the book. Can you please show the title of the book, please?
Sure, it's Fitness Over 50, 60, 70, and beyond.
Fitness over 50, 60, 70, and beyond. A lot of people who can use this.
Yeah, I used to always say fitness over 50, and people would say to me, but I'm 60, I'm 70, I'm 80. So we'll put it all in there. 50, 60,
All the
70,
decades.
and beyond.
Yes, all the decades are there. That's great. Thank you so much for your interview and for sharing your insights today.
Thank you so much for your time.
Thank you. And thanks everyone for joining us live. I hope you enjoyed it, and I'll be back with another conversation. Bye for now.